Hi guys, it's Shirley Becker and welcome back to my channel. Quick introduction, my name is Shirley Becker. I studied my undergraduate at the University of Cambridge. I did natural sciences, specialised in chemistry, did stuff for 2 years, another video, and then decided I wanted to apply to do graduate entry medicine, which is basically a medicine course for people who have degrees, and I got an offer from the University of Cambridge to start studying medicine in 2019. I'm aware that some of you who've applied for medicine have their interviews coming up in February, March time. I'm going to take what I had learnt from my Cambridge interview and my medic friends, particularly Michael and Iman, going through this interview preparation workshop. Hopefully it's helpful. Just as a side note before I begin, I think that I'm going to make a second channel that is called The Pending Medic, just so I can keep this channel kind of fun and light-hearted and then move all my medicine stuff onto a separate platform. So let me know what you think of that idea, comment down below. Follow me on Instagram if you want to follow kind of my personal pictures at Shirley Becker. So, in terms of interview style, for medical school, most of your interviews across the country will be the MMI style, which stands for multiple mini interviews. You can expect to have different stations, and at each different station you'll typically be assessed on a separate skill, personality trait or attribute. You spend about 5 to 10 minutes on each of these stations. I had 12 stations, including a resting station. You might have 10, 9. You will end up kind of having a short discussion with many different kind of interviewers, assessors, academics, rather than kind of having an intense chat with just one of them. However, for Oxford and Cambridge, the undergraduate medicine course, you will have one long traditional interview, which will usually be with 2 to 3 academics and lasts about 30 to 60 minutes. I suppose there are advantages and disadvantages to both. If you feel like you've messed up on one station, you get assessed completely separately in the multiple mini interviews and you kind of get a chance to redeem yourself on the next station, whereas I feel like it feels a bit more intense when it's the same person assessing you and they've seen you mess up. But again, different people prefer different interviews. I think personally for me, I prefer a long traditional interview, but some people kind of prefer the quick fire, 5 minutes, 5 minutes, 5 minutes. By the way, 5 minutes is a lot shorter than you would expect. Okay. So moving on to assessment. So I've mentioned about in multiple mini interviews, you will be assessed for a different skill, personality trait or attribute at each station, whereas in your one traditional interview you'll kind of be assessed on all of these things within one single conversation. The kind of things that you can expect to be assessed on are things like motivation, situational judgment, subject knowledge, knowledge of healthcare, so kind of the structure, the routine they adopt in different wards, challenges and rewards, and lastly, relevant experience. This list is not exhaustive, it's just the main themes that I could come up with. So now we're going to move on to the actual interview preparation section of this video. I will go through each of these assessments in turn. We're going to look at a broad kind of question that you could be asked about one of these assessments. I'm going to give you guys some time to answer the question for yourselves in the comfort of your own home. Then I'm going to give you an answer that I've prepared, that I suggest, and then we're going to analyse it paragraph by paragraph so we can kind of discuss what about that answer makes it appropriate or applicable, in my opinion. I think this works best if you have a pen and paper to hand. You actually pause the video when I say kind of take the time to answer the question, just so you can kind of self-reflect on the things that you would have actually said and then develop your answer based on some of my tips if you like them. So let's begin with motivation. So motivation is kind of the part where they can assess your drive and motivation to want to become a doctor or to want to study the medicine course to eventually become a doctor. So this is your opportunity to kind of really explain what it is about medicine that you love and that you like. The example question that we're going to use for today is, why do you want to study medicine? Pause the video, give yourself 3 minutes to just answer this question out loud to yourself. Once you're ready, press play and we'll go over an answer that I've suggested. Welcome back. So I hope you've answered the question. So this is a broad question that I think you can prepare a standard answer for, because it's likely that you'll get asked some type of variation of this question. Before we go over that, I'm just going to give you guys a few pointers to consider and kind of the trap that a lot of people fall into, and then we're going to look at my answer. So it's very tempting to say that you want to study medicine so that you can become a doctor, so that you can help people. The issue with this kind of very generic answer is that there's so many career paths, so many ways in which you can help people. You can become a policeman. Those people help people. Teachers help people. Nurses help people. People who paint your nails help you, okay? So saying you want to help people is a bit too generic and does not point out why you want to study medicine specifically to help people. Your answer to this question, you really want to home in on the uniqueness of medicine so that they can't come back to you and say, well, if you want to help people, then why don't you become a teacher? Why don't you become a policeman? The main thing to consider for this is that you want to go with what is unique about medicine that then entices you. Breaking that down even further, medicine is unique because of the academics that underlie medicine. So your academic interest is something you could talk about. Some examples of your potential academic interests are showing on the screen at the moment. The skills required to be a doctor are not skills necessarily required or demanded within every profession. So that can make medicine and being a doctor unique. Last of all, your career aspirations. I mean, if your career aspirations is to be a gynecologist, you know, no one can really ask you why you're not becoming a policeman, because policemen aren't gynecologists. When it comes to structuring your answer, these are the kind of things you might want to consider. Now we're going to have a look at my answer. I'm going to read it and then we're going to analyze it. Medicine is an opportunity to merge my scientific interests in areas such as pharmacology and anatomy with my skills and career aspirations to ultimately contribute towards the welfare of others. During my internship at the UCL Pharmacological Research Lab, I researched the action of capsaicin on TRPV1 receptors and its potential use as a local anesthetic through receptor desensitization. This gave me an insight to the academic side of medicine and the sort of things I could potentially be studying on the course. As a doctor, I think it's important to not only know what things work, but also be familiar with how they work. I look forward to studying medicinal sciences in greater depth. I aspire for my career to have elements of problem solving, communication, teamwork, and decision making. Doctors must use such skills daily to overcome challenges. That's a lot to just take in one go. I'm going to go through each paragraph, I'm going to analyze it and kind of say why I said the things that I said, okay? So looking at the first paragraph, I think it's very important in your opening statement of your answer to kind of define what medicine is. And when I say define, I mean define the uniqueness of medicine. So ultimately, in my opinion, medicine is a combination of science and practical skills married together that prepare you to be able to contribute towards the welfare and healthcare of others, okay? So opening this statement in this way kind of demonstrates that you have this broad view of what medicine really is, and makes it harder to argue against why you wouldn't want to study something else or pursue another career. Next paragraph, I talk about some of the kind of lab internships I've done and the research I've done. But ultimately, what's good about this, implementing this in my answer, is that it demonstrates that the academics I can expect to confront on my medicine course are consistent with the interests I have outside of my A-level syllabus, okay? So if you have done a lab internship or if you have kind of researched something outside of your A-level syllabus, this is a good way to implement kind of the academic interest part of your answer to say, hey, I know that in medicine I might study things related to pharmacology. It just so happens that I'm very keen and interested in pharmacology. So that's basically what this paragraph is trying to do. Okay, so the next paragraph is your opportunity to mention some of the practical skills that is required by a doctor and kind of try and say that these are the skills that you want to be using anyway, so that it makes a lot of sense why you want to do medicine. Medicine requires you to do problem solving, to make decisions, to have time management skills, all of these things, and saying that I, in my future, want to make sure that I implement these skills into my career kind of says, okay, it makes sense why you want to do something like medicine, because doctors have to implement these skills into their career. In addition to this, it shows that you're aware that there is this practical element to medicine. I think it's very easy to get wrapped up into this idea that medicine is just a theoretical study. I would say that's actually the lesser part of medicine, and more of it is actually the practical application. And so making mention of this, I think it's good because it shows kind of that you're aware of the balance between academics and practicality. When it comes to a generic kind of blanket structure that I can propose to you to a question that is, why do you want to study medicine, or some sort of variation of that. In your first paragraph, define medicine. Define medicine in a way that makes medicine sound unique in comparison to other subjects that you could have potentially studied, okay? In your next paragraph, you're going to want to break down the academic aspect of medicine and show that it's consistent with your academic interest. And then you're going to want to go into the practical application or the skills part of medicine and show that it's consistent to something that you want to have or want to use and utilize when you're older. And then a closing statement, which I didn't really do in my answer. This is your opportunity to kind of say, everything I've said ultimately allows me to fulfill my end goal or my ultimate endeavor, which is to help healthcare and welfare. I think it's very tempting to think, because they've asked you one question, it's a very simple one-line answer. You've got minutes to answer these questions. So a minute is actually a very long time in terms of when you're speaking. And so don't think that kind of saying 3 paragraphs is overkill. Otherwise, they're just going to fire more questions at you. That is essentially going to suck these answers out of you anyway. Let's move on to the next assessment point. So situational judgment, the thing that assessors are looking for here is to be able to tell whether you as a doctor would be able to make safe and sensible decisions, essentially, okay? The UK CAT would have been the most similar thing that you would have seen to kind of the situational judgment aspect of your interview. It also serves as good preparation to be able to think in the appropriate mind frame. I don't know about you, but when I kind of practiced for the UK CAT, I became very kind of one-minded about my approach to situations. You know, cheating is never an option. You always have to help people. That's your priority, and da-da-da. And kind of having that mindset, you're going to want to demonstrate your ability to have that mindset when it comes to answering these questions, okay? The scenario that I've come up with: a mother is unsure whether or not she wants to vaccinate her child. She has recently heard rumours about links between autism and childhood vaccinations. What do you do? So again, I'm going to give you guys 3 minutes to answer this video. Pause the video, and when you have said your answer out loud, press play, and I'll be here to analyse my own answer. Welcome back. Now we're going to take a look at things that I think are important to consider when you're answering any sort of situational judgment. Not just this particular one, but any kind of medicine situational judgment, because there are a few things that you kind of always have to apply, or you kind of always have to approach with this kind of mindset. It's tempting to get trapped into this idea thinking that as the doctor you make the decisions and you know what's best and there's only one way of thinking about things. Actually, there's a such thing as patient autonomy, which means that you as a doctor can give you a recommendation, but the patient then has the right to refuse or accept your recommendation. So the decision isn't yours, for starters. And second, as a doctor, it's actually really important to be able to remain balanced and to be able to be understanding of people's misconceptions or people's feelings towards things, okay? You might have said something in your answer like, I will impose a vaccinate. I'm not sure that you guys would have said this, but it's possible. I will impose this vaccination onto my patient, which that's not how you're going to want to approach it. So the point is that I've come up with for this answer is the risk and benefits. So you're going to need to inform your patient about all the applicable risks and benefits. You're going to want to be able to consider alternatives, and I'll get to this point when we look at my answer, but being able to kind of assess a scenario and come up with alternatives is a good skill to have also. And lastly, be able to consider patient autonomy. Like I just said, the patient has the right to refuse or accept your recommendation, but not to demand a different treatment, which ultimately means that the decision is not yours, it's the patient's, okay? So let's have a look at my answer. In order for the patient to make a well-informed decision, it's my responsibility as a doctor to make the patient aware of all the applicable risks and benefits, as well as detailing the scientific backing, or lack thereof, behind the rumours. I would assess the necessity of the vaccine and the impact it would have on the child's safety to not be vaccinated, or perhaps to postpone the vaccination to allow the mother to have some time to think. Overall, I would do my best to provide the patient with my medical and professional opinion, such that they're able to then make the best decision for themselves. But I understand that due to patient autonomy, the mother has the right to refuse my recommendation. Quite a full-on answer. Let's analyse it paragraph by paragraph. So in the opening paragraph, being able to mention that, you know, it is your responsibility as a doctor to make the patient aware of the risks and the benefits is a really good thing, because actually for every procedure that a doctor does, you are supposed to know as a patient what the risks are, what the benefits are. But nowadays there are a lot of routine procedures that we do, such as blood tests or taking your blood pressures, where we apply kind of assumed consent. So you putting your arm out, for example, gives the doctor consent to do the blood test or to do the blood pressure. That in mind, sometimes a doctor doesn't necessarily go into all the kind of, here are the risks, here are the benefits. But normally for proper practice, you would actually be going over all of the applicable risks, all of the applicable benefits, and letting the patient make a well-informed decision. That's your responsibility as a doctor. So pointing this out at the start of your answer kind of demonstrates that you are aware of this proper practice. Okay, the next paragraph the child safety, mentioning the child safety is absolutely paramount, because all of your answers in situational judgment are gonna have to put the patient's safety at the forefront of your answer. That's the most important thing. Patient safety, I can't even speak. Patient safety, patient safety, patient safety, okay? Whenever you hear a situation, think about how to keep the patient as safe as possible. In terms of the part that it says possibly postponing the vaccine or not having the vaccine at all, is the part where you kind of consider alternatives, okay? The less specific the information given to you in the scenario, the better, because then it allows you to say, in this case, I could do this, or in that case, I could do that. Applying it to this specific scenario, you could consider, it depends on what the vaccine is for. If the vaccine is for something serious, such as the MMR vaccine, then it would become less appropriate to not vaccinate the child, for example. However, if this child is getting vaccinated for ... insert something less important or something less immediate, for example, a vaccine for a holiday that isn't happening for a few months, then it would become more appropriate to postpone the vaccine, allow the mother to have some time to think, Being able to consider kind of alternative options is a good skill to have, because it's very easy, again, to have this rigid mind of, I know vaccines are good, so vaccine is the only answer. No, sometimes you're going to want to have to prioritize the patient's comfort and put the patient at ease, and if postponing the vaccine where the vaccine is not immediately required or necessary could actually serve as kind of a good part of your answer and a good thing in real life as well. My next paragraph mentions patient autonomy, okay? So being aware of this idea of patient autonomy is actually pretty important, because as I've mentioned about 2 times now, it's the patient's right to refuse recommendation of your treatment, okay? You as the doctor do not get to decide for the patient that you're going to administer something, or you're going to carry out a procedure, or you're going to do certain operation. The patient actually makes this decision. Of course, here we're talking about a child coming with their mum, so it'd be the mum who has autonomy to make that decision. For children under 16, there's a such thing as Gillick competence, which you might want to look up, which kind of links patient autonomy to patients who are below the normal age to be able to consent to treatment, okay? In terms of structuring that answer then, explaining the risks and benefits to the patient is very important so that they can make a informed or well-informed decision. Think about the possible alternatives that you could provide, and then lastly, making sure that you consider patient autonomy and understanding that it's not your decision. And so everything you do beforehand kind of leads up to this idea of patient autonomy, because you're going to want them to make their own decision, yes, but as well informed as possible, which is your responsibility to make them as well informed as possible. So next, subject knowledge. So you might be tested on your subject knowledge at 1 or more of the stations. I think I had 4 stations which tested biology, chemistry, physics and maths in turn. Okay, so I'm not sure if this is the same for every university. Obviously there are a broad range of things that they could assess you on within all of those scientific disciplines. They're likely going to come from the 3 sciences and maths at GCSE and A-level levels. And so instead of going into example questions, I'm just going to go into the kind of topics that you might want to revise. This is by no means an exhaustive list. It's just off the top of my head some of the topics I could come off. So they're showing on the screen now. Preparation that you would have done for your BMAT, for me anyway, served as a good reminder for some of the things that I did years back at GCSE or years back at A-level that I hadn't done for ages. For example, physics I hadn't done since I was in year 12. My tip for how to kind of approach these things is just to think out loud. Think out loud. When they ask you a question, an academic question, you're not expected to just be able to blurt out the answer in a matter of seconds. Discuss what's going on in your head. Discuss how you're approaching the question. Discuss your thoughts in general, because even if you don't come to an answer, they can then assess your way of thinking, which would be the point in this assessment station or in your long interview. In the undergrad Cambridge and Oxford interview, the long interview will predominantly consist of subject knowledge assessment rather than personality traits and attributes, okay? So just bear that in mind. But like I say, the biggest tip I can give to you is think out loud, break the question down, tell them what you're thinking, go through it step by step, and don't think you need to come up with an answer in seconds, because that's really not what you need to do. You just need to tell them or be able to demonstrate your way of thinking. knowledge of healthcare. In terms of knowledge of healthcare, I'm talking about the systems, the structures, the bodies, the regulation, all of those kind of things. So you're going to want to be aware or familiar somewhat, to some extent, with our healthcare system and the things related to that, okay? The example question that I've come up with is, what sources of information are available to you as a doctor in terms of scientific knowledge and information of practice? Guys, I was not born in England. I've probably made a lot of spelling mistakes and just errors. So give yourselves 3 minutes to answer the question out loud, and then as always, we'll come back to the video and I will give you my answer, and then we'll analyze it paragraph by paragraph. So welcome back, and let's have a look at some of the things I thought would be important to consider when approaching this kind of question. In terms of knowledge of the healthcare system, there's not really this magic formula to approach this question with. There are two things that could happen here. You approach it with logic and come up with generic and broad ideas, or you're familiar with the healthcare structure, systems, routines, etc., and you just are able to actually use names and be able to kind of define those things, okay? In terms of sources of information, the things you could consider are the bodies that exist. So things like the GMC, the Royal Societies, etc. Next thing are obviously the people around you. Okay? Even though this sounds like quite a basic answer, it's actually very important to be able to think in a complex way, but also in a very simple way. So although someone might know every single Royal Medical Society that exists in the world, it doesn't sound as good as someone who knows some of them and also knows that you can just ask the nurse that you're working with, because that's very valid and that's probably the thing that's likely to happen in real life. Staffing resources, so the people around you, things like consultants, things like other junior doctors or other doctors, nurses, so on. Next, wider sources. So using things like books, using things of the internet, etc. There is no kind of beautiful way to say this. It's gonna sound a little bit like a list. It sounds nice if you don't try and make it sound like such a list, saying like the GMC, the Royal Society, and the way to do this is kind of to know what each of them or how each of them are useful and fill a sentence in that way. My answer: there are several institutions, bodies and organizations within medicine that are responsible for setting guidelines, providing advice and regulating practice. The GMC provides guidance of professional conduct. Royal Colleges set standards for patient care. NICE provides evidence-based recommendations. A big aspect of medicine is the teamwork effort. Hence, there are several team members that you could turn to for advice. Consultants are highly experienced within their field. Nurses have lots of experience and patient-to-nurse contact. There are plenty of sources of information available: lecture notes, books, although this might be a bit more time consuming, and the internet, but you must be able to differentiate accurate from false information. Analysing this paragraph for paragraph, in my opening statement I spoke about the institutions, the bodies, and the organisations that exist. So being aware that they exist in the first place is a good thing, but then being aware of who they actually are and what each of them do is even better. So this is kind of a case of either you know it or you don't. I would recommend becoming familiar with these things. Next, several team members. I mentioned in my next paragraph, again, being able to think simply as well as being able to think in an impressive way is super important, because most of the time you're going to have to go to the most simple kind of thing to save yourself from time, to save yourself stress, all of these things. I would just point out here that a lot of people would have probably picked up on I can consult my senior when there's something I don't know. Actually, in real life, think about it. Right now you're probably sitting your A-levels. If there's something you don't know, do you directly go to the head of the department, or most of the time do you actually just ask your mate who is on the same level as you but probably also knows a thing or two that you might not know, and vice versa, okay? So that happens in real life as well. It's not always I'm gonna go as high as I can. Sometimes it's just your mate sitting next to you or the nurse you work with. Don't also get trapped into this idea thinking that nurses are below doctors, because that's not the case at all. And last of all, other sources of information. So this part you can start talking about when you've exhausted your list of organizations, bodies, colleagues and other important things, and then be able to say, you know, other than that, I know there are kind of logical things I could come up with, such as books, such as lecture notes. I would say become familiar with the kind of institutions and organizations before you go with this kind of broader, just logic-based answer. Going into challenges and rewards. So challenges and rewards, is the part where they assess how aware you are of the difficulties, but also the benefits of being a doctor or studying medicine or whatever, okay? It's easy to have this airy-fairy idea of being a doctor, that everything is amazing, everything's great, there are no downsides to it. It actually sounds a lot better and comes across a lot more realistic when you pose yourself as someone who is aware that, yes, I want to study medicine because it's great for XYZ, but I am aware of the things that make medicine not so great and the things that I might struggle with and the things that might be difficult, the challenges I might have to overcome. So the question we're going to use is, can you think of any reason why you might not want to be a doctor? As ever, take 3 minutes, pause the video, give yourself time to answer the question out loud. When you're ready, press play and we'll go over my answer and analyse it. Alright, welcome back. Let's have a look at some of the things to consider and then we'll go on to analyse my answer. So some of the things you want to consider are basically the things that make medicine challenging. Very easy to get trapped by this question and to think that they're asking, will medicine, what puts you off medicine? And it's not really asking what is going to put you off medicine completely, it's just asking you, in disguise, basically, are you aware of the challenges that you will face as a medic, as a doctor? And that is something that you will need to be aware of. Any kind of question that alludes to the negative side of medicine is basically a disguised question that's saying, what are the challenges posed to medicine? Some of the challenges you might want to make mention of are time and resource constraints. So currently there are understaffing issues which we're aware about, and you'll see in my answer I'll go into a bit more. Unexpected complications. So as a doctor, there will be many times where you face complications which you didn't expect. Medicine isn't perfect, human bodies aren't perfect, complications happen, things don't always go by the book, okay? And uncompliant patients. This is actually quite an important one because, like we've mentioned before, patient autonomy means that even though you might recommend the thing that you feel in your professional opinion is best, the patient can say no. The patient can say no and refuse to take your recommendations, and that can be very difficult because obviously you're doing this job because you care about the healthcare of others, and so when you do it with care and then someone doesn't want to take your recommendation and you feel like they are making a decision that's worse for their healthcare, that can be hard. And it's good to be able to confront that reality in your interview and to be able to say how you would perhaps deal with that. I came up with this. As with a lot of professions, as well as several rewards, there are also some challenges and difficulties associated with the vocation. Understaffing is an issue that many NHS hospitals are currently experiencing. This translates into increased pressure, longer hours, and limited resources for doctors. I understand that I will sometimes be expected to work unsociable hours and have many extra responsibilities to compensate for the lack of staff. Medicine and the response to treatment is not always as expected. Doctors must sometimes face unexpected complications. Training and studying will prepare me to deal with such situations, but it's also important for me to be able to remain calm under pressure and think logically. Patient autonomy means that a patient can refuse treatment. This can be difficult for a doctor because the recommendation is made with the patient's best interest. Thus, it's sometimes necessary that you must desensitize your passion for a desired outcome where you cannot force the patient to comply. So having a look at the breakdown of my answer, kind of the opening statement prefaces that you're aware that there are challenges and that medicine isn't this airy-fairy thing that's just good, good, good and more good, okay? So I think having an opening statement really serves as a good preface for the rest of your answer, because it kind of keeps you on track to basically say, I know that they're asking me for the challenges, let me now outline the challenges. The understaffing issue in the NHS, this is kind of a current affair, I suppose, and it's good to be able to demonstrate that you're aware of the system that you're thrusting yourself into, because as an F1 and an F2 junior doctor, you will have to do this under the NHS. So it kind of demonstrates that you're aware what you are personally letting yourself in for. Unexpected complications, like I say, it's very easy again to be airy-fairy about medicine, but this time in a way where you think you've studied this in lectures. So I've studied diabetes in lectures, so when I get a diabetic patient, it's going to go exactly how it was supposed to go according to the book, and the person's going to respond to the treatment exactly by the book. Things don't happen in reality by the book, okay? So it's important to be able to realistically understand that medicine faces complications, and you as a doctor will have to be able to be calm and try and use your problem solving skills to overcome such challenges. This last sentence sounds a bit crude. Desensitize yourself basically to emotion towards or attachment towards the patient. But I think this is actually quite an important point, because you can't force a patient to do something that you feel like is best for them to do. And so if you are constantly pouring your heart into wanting the best for the patient, not that you shouldn't want the best for the patient, but if you constantly become too emotionally attached to this idea, it will break you when the patient doesn't listen, and it might lead you to act unprofessionally. It might have a negative impact on you. And so it's actually quite important that you're able to cope with essentially not being able to force someone to do what you know is best or what you think you know is best. In terms of how to structure this answer then, I think a good structure for this is, first of all, in your opening statement, to be able to demonstrate the challenges, or demonstrate the fact that you know challenges are faced as a doctor and within medicine. And then give an example of one of these kind of challenges, and then say how it would actually impact you as a doctor. Give another example and then say how you would possibly overcome it. So for me, that was desensitizing myself to my burning passion to help people where I can't force them. And then a closing statement, which I didn't really have. If you want to, you can insert this closing statement, which I actually think sounds quite nice, is to be able to say that although, you know, all of these challenges are downsides that you'll face within medicine, your passion for medicine far outweighs the idea of the challenges that you'll face. So I think that sounds quite nice if you're someone who kind of wants to express that what I'm saying is not something that puts me off medicine. Go for it. Last, I think, the last bit is the relevant experience. So this one is actually a bit tricky for some people, because I think some people have this misconception that they need to have done the best experience at the best hospital and it needs to have been shadowing a doctor specifically. No, this is actually, in my opinion, a misconception. One second. You basically don't need to have done work experience in London's top hospital shadowing a doctor. It doesn't even need to be shadowing a doctor. You'll be surprised how far you can actually stretch your work experience to make it relatable to medicine. In general, anything that helps vulnerable people, whether that would be disadvantaged, underprivileged people, old people, disabled people, any kind of vulnerable group, if you've helped them in any way, that is applicable to medicine, because in medicine, you're basically helping vulnerable groups, okay? So that can range from anything between teaching underprivileged children or painting an old lady's nails at an old person's home and like talking to her and making sure that she has kind of conversations with a human. Those things are all applicable things to medicine. Given that there are a range of work experiences that you could have possibly completed, I'm not going to go into an example question because your answers are going to be so different from each other. I'm instead just going to give a range of tips, okay? So my first tip is relevant does not mean specifically I have shadowed a doctor at XYZ hospital. Relevant just means I have helped vulnerable people or a vulnerable person or whatever, vulnerable groups in some sort of way, okay? So as we've discussed just now. Tip number 2 is to express what you got out of it. So even if you are someone who has done Kensington Hospital, shadowing, surgeon, whatever, Harley Street, watching breast implants happen, like, there's no point listing them off, because what we need to know, or what the assessors need to know, is what did you actually learn from that? What did you get out of doing all of those things, okay? So rather than just listing things off, what work experience you've done, say the work experience that you have done and then what you've learned about it, okay? You can talk about things like the challenges you faced, the knowledge you've acquired, the structure that the NHS adopts. What about the things that you've learned are directly comparable to medicine? So for example, if you teach children that are of low academic ability, being able to explain things in a very simple way is applicable in medicine, because doctors are going to have to explain complicated medical things to people who have never studied medicine or might not even know anything about medicinal sciences. So my next tip is focus on a range of things rather than a single point. So I actually kind of went into this trap myself, where it's very easy when you start talking about one of your experiences and what you learned about it. You kind of feel like there's so many things you learned about it, or you kind of feel like what you learned about it was so significant that you end up talking, and before you know it, your time at the station is finished. So I would focus on a range of things and not kind of drown in one long point or one single point, okay? So I would be pretty concise and kind of accurate about my points, but keep them concise and be able to kind of spread them over a range of experiences and then a range of applicable lessons that I've learned. Next is structure, okay? So to be able to keep your answer concise, it's nice to kind of have a structure in mind of how you're going to approach this. And I think a good recommendation for structure that I came up with is to have, to list your experience. So to say what experience you did, and who you were basically focusing on helping. For example, I painted the nails of old ladies in an old person's home every Saturday, okay? And then the lessons that you then learn from it, okay? So this is the important thing, not the listing, but the lesson. Not the listing, but the lesson, okay? And then its applicability to medicine. So I painted the nails of old ladies in an old person's home every Saturday. What I learned about this is the impact that communication or frequent communication can have on someone's mental health. I think this is applicable in medicine because it allows you to bear that fact in mind when it comes to your bedside manners. Sometimes it's easy to focus on the treatment aspect of medicine and not approach medicine holistically and recognize the impact that the more simple things that are usually overlooked can have on one's mental illness and then other aspects of the illness consequently. I just made that up on the spot. You guys get the point, okay? So what I try to do is take a broad question from each of these kind of assessment points, because I feel that any other question that you could be asked is some kind of variation of the broad question. But it's now your responsibility to realize that the answers that we've kind of formulated here can be twisted in a way where they are now applicable to other questions that are heavily related to the broader questions we've approached. I feel like I've said a lot of words and it might not make sense, but let me just go over some examples. Why medicine? Why a doctor rather than a nurse? What interests you about medicine? These questions are all asking you basically, why do you want to study medicine to become a doctor? They're all asking you the same thing, okay? So when it comes to why medicine, same answer. Why a doctor, not a nurse? This is exactly why I told you to give an answer that makes medicine sound unique, because you can argue that a nurse does less of the problem solving in comparison to a doctor. Not that a nurse is less important, but the doctor's role and responsibility entails more problem solving, and you enjoy problem solving, therefore you want to become a doctor. But you've already said this, you've already answered this in the structure that we have kind of discussed in this video. What interests you about medicine? The same thing. Stating what medicine is, stating the academic interests or the academic aspects of it, stating the practical aspects of it, and then closing statement answers that question, okay? Next, what would you do if, let's propose we have I've made a spelling mistake. How would you act in a situation where, this is all sounding like a situational judgment. As soon as you hear anything that sounds like a situational judgment, and these are really not difficult to pick up on, remember that you're going to have to put the patient's safety at the forefront of your answer, considering the patient's safety is the most important thing, okay? And from then I came up with an acronym, what country am I from? An acronym IAA, okay? So once you've put the patient safety at the forefront, then it's information, alternatives, autonomy. Information being risks and benefits, alternatives being, could I possibly postpone it? Is it necessary for me to do this? Whatever else you can come up with, it depends on the scenario. And then autonomy, overall, I know that the patient makes a decision, but that's why it's my responsibility as the doctor to make them as aware as I possibly can so that they can make an informed decision. Cool. What are the challenges, ... What could be difficult about being a doctor, ... Why are fewer people pursuing medicine, ... Are all variations of, can you think of a reason why you don't want to study medicine or why you wouldn't want to become a doctor? Which then again is a variation of basically outline the challenges of becoming a doctor. All of these questions are basically a disguised way of saying, do you know what the challenges are, and outline them for me. Don't pretend that there is nothing bad about being a doctor. Be aware of the challenges. It sounds a lot better. It sounds a lot more realistic, and it sounds a lot more like you are prepared for what's to come. That brings me to the end of the video. So this is a super long video. I really do hope that it was helpful. Obviously, I've not even started my medic course, so I'm by no means like an expert in how to do an interview. Realistically, I've done one medicine interview, and I got an offer as a consequence of that interview. Granted, I got a lot of advice along the way. It still by no means suggests that I'm an expert and I know it all. I just think it's always important to share what you do feel you know, and what you did feel helped you, so that other people can use it to kind of pursue the same path if they so choose. And other than that, yeah, I have nothing to say. Give the video a like, give it a thumbs up, you know what I mean? And I hope it just wasn't too boring, but I'm gonna go now. Thank you so much for watching, and I will see you guys very soon. Bye bye.